Hi, we're here with Susan Cordts from Catalytic Health Partners, and we're talking about the innovation she's having in healthcare and the changes in outcomes and results that we're seeing. So I was talking to others in the industry, and they're very impressed with what you're doing. I've heard a lot about your health population management. Can you tell me a little bit about your approach and why it's different?
Yes, well, I founded the company in 2014, Jamie, with a focus that if we looked at social needs first and then behavioral health and then physical medicine needs, that we could totally change how healthcare is delivered. We know that research shows us that 50% at a minimum of healthcare needs are based upon us not having their social needs met, so really coming at it from that approach. The other thing that we do is we integrate all of those services together. So the social, behavioral, and physiological health is all combined together in a team that's highly integrated in an individual's home environment. So really meeting the needs of those high-risk individuals who need a lot of support. So that team works hand in hand together. And then we take that team of people and pair it with technology and data, making it very simple and scalable from that perspective. So allowing the individual in their home to have 24/7 access to us, even through the technology. So being able to have that telemedicine, that real live integration, as well as all of their data from their engagements with us captured through our app on the tablet and then into our proprietary EMR system. So it really makes us unique in terms of our approach and has proven to give us great outcomes.
Well, that's remarkable, and to hear about how you're making such an integrated approach across all lines, from social needs to behavioral as well as physical medicine, sounds remarkable. How are you measuring the impact of your work?
Yes, so we take a very data approach to that and focus on healthcare outcomes. And of course, we leverage the metrics set forth by the government, which we're all measured by. But in addition to that, we really look at the impact that we are making on an individual in terms of their personal goals and what they're trying to achieve. But additionally, other metrics that we've set forth in terms of how we're reducing their hemoglobin A1Cs, what that impact looks like, their blood pressure, all of those things, and measuring our level of engagement. So, how much do they call us versus we're having to call them and push them, and where does that flip change? So really understanding that level of engagement and measuring that against then their health outcomes as well to see what the impact is and the difference is that is made there. And then we, of course, have all the traditional measurements of cost to go with that as well. If we can change outcomes but we're not changing cost, then we're certainly losing in the battle. So making sure we're marrying both of those. And our approach has really proven to make a big impact on that side too. So really reducing those ER visits, the acute care utilization, and the total cost of care, with pharmacy being another big impact that we're making there. So it's been very exciting.
That is exciting, and to hear the impact you're having on these members' lives, but also the fact that you're using technology and data and analytics to drive change. What kind of results have you seen so far?
Well, some of the results, have been just astounding in terms of seeing, more than 90% of our members with hypertension having a reduction in their blood pressure. So, that's a big deal. Having more than 60% of them being within the goals and metrics set forth, which again, a huge opportunity there. Our diabetic members having big changes, greater than 2 percentage point drops in their hemoglobin A1C. Again, really great to be able to see. But likewise, to see the knowledge acquisition of our members and how they have really engaged in this has been great. Seeing the cost savings, when you're saving 20 to 30% of total healthcare costs in year one for a population, that's really a good impact to be able to have. With 16% of our population return to work with an average tenure of being off work of greater than 8 years. So we really measure those outcomes across a wide number of spectrums, from the social as well as to the physical side. On the behavioral health side, we have had a significant impact in the PHQ-9, which we use to measure depression, which is really one of the most predominant factors across the entire population, and seeing again stabilization and huge decreases in the PHQ-9.
That's remarkable. We often hear from professionals in healthcare that they've always wanted to do this, and I've seen and witnessed people tell you, Susan, how are you doing this? We want to do this, but we've never been able to do it. What do you tell them?
Well, it's actually doing the things that we all know need to be done, and making it, that simple. We all know that if people aren't getting to eat every day, that their focus on taking medication is probably pretty low. And certainly there's a lot of community resources out there to meet those needs. We're really just digging in and doing what I'd say is the easy stuff. We need food. What kind of food can we get? Is it the appropriate food? If not, let us provide them a grant to buy them the food so that they're having what they need to have their needs met. We certainly do a lot of that, especially as it relates to our populations who have specific diets that might need more protein than is available from other community resources. So really, narrowing some of those gaps down. And I'd say, Jamie, what we do is very, very simple. It's the common sense stuff that we all know need to be done, and we just make it happen.
That's a great outlook, and it sounds like you're really making a difference. So if people want to get in touch with you, Susan, what's the best way to reach you?
Well, of course, they could reach me through email, which is probably the easiest for everyone. So Cordts, Cordts, at catalytichealthpartners.com. They could always give me a call. My direct number is 602-332-3363. And really love to talk to them about what we do. You can get more information about us on our website at www.catalytichealthpartners.com.
That's great. Thanks for sharing your story today, Susan.
Thank you, Jamie. It's been a pleasure. Thank you a lot.